Hello, and thank you for joining us. I'm Lynn Doyle, and this is Meet the Doctors. We have a great lineup of doctors for you today to talk about the latest health news and medical breakthroughs and how they may impact you or a loved one. Please understand the medical advice given on this show is not intended for anyone individually, and that you should always check with your doctor first before making any kind of medical decisions. Now on to this week's medical news. New York State's highest court has refused to reinstate New York City's controversial ban on sales of those jumbo soft drinks. This is considered a major victory for the American soft drink industry. You see, supporters had hoped to limit consumption of those 16-ounce drinks and other foods that are linked to obesity. Other states had been considering similar legislation, but in light of this ruling, may not move forward. Former Good Morning America host Joan London recently went public with her battle with breast cancer.
What is it that you want to share with people?
I heard those words that every woman fears and never wants to hear: you have breast cancer. And you know, in the beginning, it's like such a shock, it's a stunner, and you think, I do everything right. You know, I get checked and I'm healthy, and for me, I'm a health advocate. I'm all over America talking to women saying, make sure that you get all of your checkups all the time. And in the beginning, it was kind of, you almost feel like, what did I do wrong?
Her treatment will include chemotherapy and radiation, and the good news is the 63-year-old says she's expected to make a full recovery. London said the cancer was found not in her annual mammogram, but rather in a follow-up ultrasound routinely done in addition to mammograms. We'll have the latest about that and the latest on 3D mammograms later in the show. Want to lose weight? Want to lose weight without working out or dieting? Seems impossible, right? Well, maybe not. There's a capsule being tested that swells up in an empty stomach, making you feel full. Now, people who took the capsule lost 6.1% of their weight after 12 weeks, compared with 4.1% for those taking a placebo. Boston-based Gelesis, the company developing the capsule, said it would start a larger study next year aimed at winning FDA approval. But not everyone is a believer. Critics are calling the 2% weight loss very modest. Finally, most of us have taken an aspirin if we have a headache, and of course, recent evidence has shown taking a low dose of aspirin is known to reduce the risk for heart disease. Now, scientists say it may also reduce the risk for pancreatic cancer. Patients who had been taking aspirin for 1 to 3 years actually lowered the risk for pancreatic cancer by 48%. That's right, 48%. To talk more about this study is Newsmax Deputy Health Editor Nick Tate. Nick, it's good to have you with us as always.
Good to be with you, Lynn.
When I hear that there is a drug out there as simple as aspirin that could help reduce fatalities with pancreatic cancer, I'm stunned. Why is it that aspirin could have this impact?
Well, it's really very exciting, particularly for pancreatic cancer, which is really one of the bad ones. You know, pancreatic cancer strikes without warning, and for most people, by the time they realize they have it, it's too late to do anything about it. 8 in 10 people who are diagnosed usually die within the first year, and 94% die within 5 years. So having a cancer prevention method as simple and as cheap as aspirin really is very good news for those folks. Now, you know, aspirin isn't for everyone. It does cause some problems, gastric distress, some bleeding for some folks, and if you're taking a blood thinner, it can cause more harm than good. But for those people who are at risk of pancreatic cancer, who to this point have really not had much in the way of prevention opportunities and options, this is really a terrific one.
How do we know if, in fact, we're at risk for pancreatic cancer?
Well, it's a funny thing. There really are not a lot of early warning signs. And that, as I suggested, I mean, pancreatic cancer is, we might describe it as kind of one of the ninjas of the cancer world, in that it really does strike often without any warning signs in folks who might otherwise be healthy. Usually a family history, there is some genetic component that is involved, and sometimes symptoms that are kind of unpredictable, like depression, may signal that there's something going on with your pancreas. But there really isn't a lot of good evidence to suggest that if you take certain steps, there are things that can prevent it, and if you're very vigilant, that you should watch for these signs. That's why a prevention method like aspirin could be a real boon to folks who are potentially at risk.
Has it actually been used in individuals who have already been diagnosed with pancreatic cancer?
In this case, what the Yale researchers did is they looked at folks who did not have pancreatic cancer, and they gave them aspirin and compared them to folks who didn't get aspirin. And what they found is that the folks that received aspirin did not develop pancreatic cancer. So the evidence suggests that, in fact, it will prevent it from developing in the first place. Now, most of the people who benefited greatly were the ones who were taking a daily low-dose baby aspirin for 10 years or more. But even in people who were only taking it for 3 years, there was a reduction of about 40% in the risk of developing pancreatic cancer.
Typically, when someone does hear that diagnosis, that they do have pancreatic cancer, they are told to prepare for the worst. Do you see this as a development that might actually change those statistics and change them somehow to the positive side?
Well, the more that we learn about the role of inflammation in all kinds of diseases, cancer, heart disease, diabetes, the more we learn that keeping inflammation in the body low is really important to not only preventing disease from developing in the first place, but slowing its progression. And certainly aspirin is one of those things that has that kind of moderating effect. So this may open doors that we can't yet envision to not only prevention strategies, but identifying those people who are at risk, and also in terms of treatment for those who are diagnosed. We just don't know at this point in time.
It sounds like if your doctor gave you the okay, that we should all be taking a small dose of aspirin on a daily basis, because it's proving to ward off a lot of different things that could end up taking our lives.
Well, that in fact is the main point you made is a really good one. If your doctor gives you the okay, because there are of course some downsides for some people, but people have been taking aspirin or forms of aspirin for millennia. The ancient Greeks used to take a form of it, a naturally occurring form of aspirin that was in the bark of willow trees to reduce fever and to treat pain. And now we know through scientific analysis that a chemical compound in that bark is a very close chemical cousin of aspirin. So we know it's well tolerated by a lot of folks, and there are some doctors who believe that if you're over 40 and you're already doing the good things that you should do for your health, eating right, exercising, not smoking, lowering your stress levels, well, maybe you should look at aspirin as the next thing to add to your list to boost your health. But you do need to talk with your doctor first and make sure you're not at risk.
That's what we'll do. Good advice as always. We'll take a quick break and we'll talk more right after this. Welcome back to Meet the Doctors. I'm Lynn Doyle. Remember when we thought aspirin was just for curing headaches? Maybe this will refresh your memory.
Mommy, look what I drew!
Jimmy, please, not now. I'm too busy. Control yourself. Sure, you have a headache, tense, irritable, but don't take it out on him.
You need Anacin for fast relief. The big difference in Anacin makes a big difference in the way you feel.
That poor kid. Not sure anything was going to make him feel better. Well, aspirin can still get rid of headaches, but increasing evidence shows it can do so much more. Scientists already say a low dose of aspirin daily lowers the risk of heart disease, and now it may also reduce the risk of pancreatic cancer, which, as you know, is a swift and incurable cancer. To give us more insight into this perhaps life-saving drug is Dr. Nisa Goldberg, a cardiologist and the director of the Joan H. Tisch Center for Women's Health. Dr. Goldberg, it's great to have you with us.
Thanks. It's exciting about the benefits of aspirin.
Would you say that it truly can now be considered a life-saving drug?
Well, we always thought it was a life-saving drug because it prevents heart attacks, and heart attacks are the leading killer of men and women in our country. In fact, the first thing we do when someone is having a heart attack is we have them chew an aspirin, because heart attacks are caused by blood clots, and aspirin stops blood clots in their tracks and saves heart muscle when you come into the hospital.
But that's not the only thing we should do if we think we're having a heart attack.
No.
Popping the aspirin is not where we stop.
You know, you could pop the aspirin with one hand and touch your phone with the other, calling 911.
We just heard Nick Tate give us a report about pancreatic cancer and how aspirin is now being touted as a way to prevent pancreatic cancer as well as heart disease. Would you recommend that every American, if their doctor suggests, take an aspirin every day?
Not yet.
Not yet?
Because the study on pancreatic prevention of pancreatic cancer is interesting, but it's still a relatively small study. We really need to test it out to see if all people benefit from taking that aspirin to lower risk for pancreatic cancer. We've had other studies that have shown that aspirin can also reduce the risk for colon cancer, but we don't routinely give people an aspirin to reduce risk for colon cancer. We do commonly give people aspirin to reduce risk for heart disease.
You said before that heart disease affects men and women differently. How so?
Well, women are more likely to get their first heart attacks about 10 years after menopause. Men get their first heart attacks in their 40s and 50s. And in fact, there have been two separate aspirin studies, one done on a large group of men and another done on a large group of women. And we found some interesting things about those studies. An aspirin a day, a low-dose aspirin a day, does reduce the risk for a first heart attack in men, but not in women until they're at the age of about 65.
And the symptoms, I understand, present themselves differently between the sexes.
Yeah, we're used to men having that Hollywood heart attack with crushing chest pressure, going down their arm, short of breath. And women can have that symptom, but more commonly they have shortness of breath at very low levels of exertion, unexplained fatigue. Sometimes the pain is near their belly, so they mistake it for a stomach ailment.
Are we also the type that put it off and say, you know
Definitely.
what, I don't have time to deal with this right now, so I'll just take an aspirin or I'll lay down for a bit, but we don't necessarily seek medical treatment?
No, or I'll have patients come in to me weeks later and say, I thought I was having a heart attack and I took an aspirin and then looked up the symptoms on the internet. And I said, don't waste the time. If you take the aspirin because you think you're having a heart attack, you have to go to the hospital. Call 911.
We hear about heart attacks probably more frequently than anything else, but heart disease is a #1 killer of women, particularly in this country.
That's right, and although awareness has increased a lot in women, they still don't think it's going to happen to them. So we really have to take steps to prevent heart disease. And in particular, women under 50 are still not taking those steps. So although we're very successful in lowering rates of death due to heart disease in women over 50, we have to start working on the younger women to prevent premature heart attacks.
And what can we tell them? What kind of advice would you give a younger woman so that she does not become a victim of heart disease or a heart attack later in life?
Quit smoking.
Oh.
So many young people are smoking. And if you're active when you're young, keep it up. You may not be able to do the same high impact activities as you get older, but then again, maybe you can take some aspirin for those knee pains. But you really need to keep active because exercise, taking a moderate paced walk, lowers your risk for heart attack and stroke by 50%.
Finally, I have to ask about the disadvantage that might be associated with aspirin for some people who would be watching this.
Well, if you're someone who has stomach problems, it can increase bleeding in the stomach. If you know that you have a high tendency to bleeding and bruising, you really need to talk to your doctor before you do that.
That's the advice that we always try to leave viewers with on this show, is talk to your doctor. We want to start the dialogue, but you have to talk to your doctor.
That's right. You really should start a dialogue with your doctor. That's how you can improve your health.
Well, we certainly appreciate the dialogue that you gave us today. It was nice to have you with us.
Thank you.
Now, has this happened to you recently? A friend suddenly tells you they can't go out to dinner with you because they're on a gluten-free diet and there's nothing on the menu they can eat. Is this a new craze that's sweeping the nation? We're going to find out. And should you be involved in it? Stay with us. So it's the latest diet craze, a gluten-free diet. Don't know what it is? Don't worry, you're not alone. Jimmy Kimmel on his late night show, Jimmy Kimmel Live, wondered about it too.
People are very anti-gluten, which bothers me because I'm very pro-pizza, and you can't be pro-pizza and anti-gluten. So now some people can't eat gluten for medical reasons, which that I get. It annoys me, but I get it. But a lot of people here don't eat gluten because, like, someone in their yoga class told them not to. I keep asking people about this, and I started to wonder how many of these people even know what gluten is.
And what is gluten?
Well, as far as for me, how it affects my body,
But what is gluten?
this is pretty sad because I don't know.
What is gluten?
Does Jewish John Hamm know what gluten is?
It is part, I believe, of the wheat that I really don't know.
That's hilarious. The gluten-free dieters don't even know what gluten is. But do you? We're going to find out, because on a serious note, what it is makes a difference in how you eat and your health. We're going to go back to our South Florida studios, where our deputy health editor Nick Tate is standing by with information for those of us who are saying, what the heck is gluten? Can you help us out, Nick?
I sure can. You know, 10, 15 years ago, none of us had ever even heard of gluten, and there's obviously, as Jimmy Kimmel shows us, a great deal of confusion about it today. But glutens are proteins that are in wheat products, and they do cause a problem for people with a particular condition called celiac disease. But what's interesting is that gluten-free foods are fueling a multi-billion-dollar industry in this country, and as many as 1 in 3 restaurant goers in places like New York and Los Angeles are asking for gluten-free products on the menu, gluten-free menu items. Facebook has about 1,000 groups with the phrase gluten-free is in it, and there's even a gluten-free singles group. So it's really a craze that's taken off. Now, until recently, doctors mostly recommended folks go gluten-free if they have a medical condition called celiac disease, which means that they cannot process gluten. It causes an autoimmune system. It causes problems for their intestines. But a growing number of nutritionists and some doctors are now saying that that view is changing, and in fact, going gluten-free can benefit even people who do not have celiac disease. It lowers inflammation, it contributes to weight loss, and there are some other benefits too.
It seems like we've been hearing a lot about inflammation throughout this entire show. So we're going to get some more information now from our guest in the studio, Dr. Robert Newman. He's a certified clinical nutritionist and a wellness expert. It's good to have you with us.
Nice to be here, Lynn.
So you heard Nick comment on celiac disease. Let's talk about that first up and describe what it is and how many people it affects.
Okay, so as Nick mentioned, it's really gluten is the protein of the wheat, barley, rye, spelt, kamut, all these different grains. They're even finding it in some oatmeals. So essentially what happens is the individual will have an autoimmune reaction to this, and in celiac disease, the villi, which are really the lining of the small intestine, your body's attacking it, and it sloughs off. Now the villi are so critical for really absorption of nutrients.
Is this almost like having a food allergy?
I'd say allergy to a disease process. You know, your body starts upregulating the immune system, and you start not only fighting the gluten protein, but also it will end up fighting itself in many ways.
So people who suffer
diseases
from celiac disease and who really truly need to be gluten-free do it, because if not, they could die.
You know,
they
what
could be
happens
severely
is,
ill.
you typically will find malnutrition. You'll be deficient in iron. You'll be deficient in various nutrients. There'll be gross weight loss. Severe, sometimes even psychiatric disorders. It really just affects far-reaching aspects of the body.
And yet you mentioned the weight loss. That's probably what attracted the attention of dieters, particularly the fad dieters. They see someone who's on a gluten-free diet lose weight, and they say, hey, that's for me.
Right.
Is that a smart decision?
Really what we're talking about is a spectrum, because there's a spectrum from celiac disease to the disease process to just a sensitivity to gluten. Now, you can have a whole myriad of symptoms that will be necessary to go gluten-free.
Without talking about the specific symptoms, what impact would it have on someone who does not have them to engage in a gluten-free diet?
I'm not sure there's any real benefit if there's no sensitivity and there's no effect on the immune response, other than the high caloric intake and also the blood sugar response, which would raise insulin resistance, hence diabetes and other ailments.
Okay, so if you do follow a gluten-free diet and you don't have a medical reason to do it, you could actually have side effects as a result of it?
There are so many foods that you can eat instead of gluten-free foods, such as some ancient grains like amaranth, teff, quinoa, all the different rice.
You heard Jimmy talk about pizza. Can you eat pizza if you're on a gluten-free
there's
diet?
gluten-free pizza, sure, made out of corn foods.
And does it taste the same?
It actually tastes decent.
It does.
Yeah, if you get a very thin crust.
Okay, so do you think that most people should try to follow it and incorporate somehow into their diets?
I really think you need to
follow
go
their
to your physician to
physician
get
advice?
diagnosed. If you're having that whole myriad of symptoms and you just can't solve it, and all of a sudden you go gluten-free for, let's say, 2 weeks, and you feel so much better, that's a great response. And then what we do is blood tests.
Okay, good advice. Good to have you with us.
Thank you very much.
Thank you so much. He's going to stick around here and answer some of your email questions. And also we'll have Dr. Peter Hybert with us as well. So please stay with us as Meet the Doctors continues. We're also going to talk about the latest in 3D breast mammography. So that's something that you want to stay with us for as well. We'll be right back. Welcome back. We've gotten several emails asking whether baby boomers should go for a yearly mammogram. I know for many women it can be nerve-wracking. And now former ABC morning talk show host Joan London recently announced that she has breast cancer. So all of this has brought it back into the spotlight, particularly the subject of mammograms. I want to go back to our colleague, Nick Tate, in our South Florida studios to talk about mammography and what's new and what's the latest. Nick, first, let's answer that question. Should women of baby boomer age always be getting a mammogram?
It really depends on the woman's risk. It really depends on her age. There has been a great deal of controversy over whether women under the age of 50 in particular benefit from a regular mammogram. So there's a great deal of controversy. The problem is that conventional mammograms and digital mammograms are two-dimensional images, and they don't reveal as much about the breast tissue as they could. And it really depends on the skill of the radiologist reading those scans to determine whether a suspicious mass, a lump, something that looks like it might be cancer actually is. The problem is that with the 2D mammograms, a lot of women are referred for painful biopsies and follow-up procedures, even when those particular masses would never be harmful, they would never lead to cancer. So one of the new things that's happening is researchers are combining digital mammograms with a 3D technology that makes those images clearer, makes them easier to read, and at least theoretically at this point can give radiologists a better view of that breast tissue.
What can you tell us about the 3D mammography, particularly for the woman? Is it more difficult for her to endure? Because that sometimes is something that holds women back from seeking out a mammography.
Right. It's really not. The machines are virtually the same as traditional mammography screening, but this new technique, which is called tomosynthesis, provides a better image. It's sort of a simplistic comparison, but if you think about the images that we used to see in the Disney films of the 50s and the 60s, Sleeping Beauty and Bambi, and compare them to Avatar or some of the 3D films, you can really see the differences and the amount of information that's provided. And so what it would provide doctors and radiologists is a better view of the breast. For women, there are some downsides, though. These new 3D mammograms do have more radiation. It's about twice as much radiation as a traditional mammogram, and they cost more. They're about $100 more than a traditional mammogram. So those considerations really need to be weighed.
Thanks, Nick. We certainly appreciate that information. To give us even further insight, joining us now is our Newsmax contributor, Dr. Peter Hibbert. He's also in our South Florida studios. Peter, it's good to see you. Thanks for joining us.
Thank you. My pleasure.
Nick just mentioned that there might be some downsides to 3D mammography. What might they include, in your opinion?
Well, when we look at mammography, we're using X-ray ionizing radiation. And so the dosing for a 3D mammogram is higher than a conventional mammogram.
So what would that mean to the patient?
Well, I think you're exposing the breast to a higher rad. We know, and we've advised people under the age of 50, unless they have high risk factors, to look at screening procedures in the form of mammography only once they've reached age 50, unless something is overwhelmingly in favor of exposing the breast earlier. I think the big deal for me is that we need to select people who are going to have to get higher doses, and for what reason? We're using a screening. This is a screening test. Remember, a mammogram does not pick up all cancers, even when there's a cancer there. A mammogram can be read as normal, and even a 3D mammogram may indeed be the same way. I mean, we have young people with dense breasts in their late 20s, early 30s that will have normal mammograms, and they have invasive carcinoma.
We've been hearing that terminology, dense breast, recently. What does that mean exactly if a woman has been told that her breasts are dense?
I think what we're talking about is glandular tissue. If the breast itself is dense, has dense glands, not a lot of fat in it, the contrast is a little more difficult for the radiologist to see. Mammograms are not just like pictures. They're rather hard to interpret. Even most surgeons and general docs, ER docs, we don't look at mammograms the way a radiologist does. You really have to be a specialist in reading these because they are so difficult to read the way they are. Now, the 3D mammograms are going to make it a good deal easier to interpret the depth and the nature of these things, but I think the same problems are still going to be laying there. And that is, there's some people that simply will not have their cancer picked up on mammography, and they need to be either an ultrasound or an MRI needs to be considered when someone's thinking there might be a malignancy issue going on.
Let's talk about the ultrasound, because that's how Joan London said she found her cancer, not through the traditional mammogram, but in the follow-up ultrasound. Would you suggest that become regular procedure for most women?
Look, I think if you've got a family history of breast malignancy, you've got to do whatever you need to do to screen yourself sensibly. And to wait until age 50 is silly when you've got a positive family history. An ultrasound augments the information you get. Remember, breast self-examination is the beginning of drawing attention to something that seems wrong. And if you use technology to try to find out what it is before you biopsy, it makes good sense. An ultrasound will help define whether it's a cyst or it's solid. And I think the thought of just relying on a mammogram to pick up problems in breast tissue is probably not the best way to look at a mammogram.
Are insurance companies on board with the ultrasounds and the 3Ds, or are they putting up roadblocks and saying, wait a minute, you can get it, but we're not necessarily going to pay for it?
I think probably the ultrasounds are probably being granted pretty easily. The mammograms are being granted pretty easily. It's the MRIs that they're balking at.
What would you suggest for women who have been told they have dense breasts, who do the breast exams on a regular basis? Would you suggest that they ask their doctors about ultrasounds and or 3D?
I don't think I'd push the 3D at the moment. I don't think there's enough information to justify, again, exposing young breasts to radiation early. We have baseline mammograms we advise women in their 30s to used to, and at this point, there's even some debate whether the baselines are needed. The ultrasound's nice in that it doesn't expose the breast to any risk of increasing malignancy. And if you mammogram and mammogram and mammogram and mammogram, the British studies were the first that came out and said, hey, these mammograms may be causing some breast cancers. So that's why the dosing and the ages were adjusted somewhat, because there is a risk.
All right. Dr. Peter Hibbard, thank you very much for your insight on breast cancer. As always, we suggest our viewers talk with their individual doctors before making any kind of decisions, but we're trying to give you as much information as possible so that you can make the right decision for you. We're going to take a short break, but when we come back, it's your questions that we'll be answering. Our doctors are staying in the studio, and they're going to answer all the questions that you have. We'll be right back. Welcome back to Meet the Doctors. I'm Lynn Doyle, alongside board-certified nutritionist Robert Newman, and in Florida, our own Newsmax contributor, Dr. Philip Hibbard. This is the chance that we give you each and every week to write in and ask questions of the doctors, and then they give you their expert opinions. Again, we always suggest that you talk to your own doctor, but this starts the dialogue. So you ready to go? Dr. Newman, let's start with you. This one says, I'm a 41-year-old man. I weigh 185 pounds and my total cholesterol is very high. I'm on statins, which I have been taking morning and night for 2 years, but my numbers are still very high. What foods could I eat to help lower this number?
Okay. Well, your mother and grandmother always said eat your vegetables, so that's certainly the first step. I want to address, when you're on a statin, you really need to make sure you're taking another supplement called coenzyme Q10. Because what happens is, by blocking the cholesterol, you're also blocking the CoQ10 from being made in the liver. And it's critical for heart health and microcirculation. But primarily, the plant-based foods will typically, fibrous foods, will lower your cholesterol.
Okay, is it that easy? Does it happen overnight?
Well, no, you have to take into consideration lifestyle. You have to be exercising, you have to be moving, you have to be burning. If your triglycerides are elevated, you want to make sure that you're watching the sugar intake, because the sugar will raise your triglycerides and your cholesterol. Also, ask your doctor to analyze the particle sizes of your cholesterol, the LDL and HDL. That's very critical. We want large, buoyant, fluffy cholesterol particles. It's very, very important to really get a good diagnostic picture.
So in the good cholesterol, we want bigger. Bigger is better.
even the bad should be large and buoyant.
Okay. Thanks so much. Let's go to another question. This one's for you, Dr. Hibbard. This one says, I'm a 58-year-old healthy and active woman. Boy, that sounds familiar. I had a recent bone density test that shows I have osteoporosis. My doctor actually said that I have the bones of an 80-year-old. I've taken calcium, vitamin D3, and magnesium since I was 30. Now my physician wants me to take Reclass. What would you prescribe if I were your wife?
Well, I think you've tried the basics with your diet and supplemental calcium and vitamin D, which is very important. And the next step is to use a prescription agent to try to increase your density, hopefully to decrease your risk of future spontaneous fracture, a fracture that might occur after you just took a minor slip and fall. And osteoporosis is one of those conditions where the bone weakens, and even with minor trauma will break. It's very brittle.
You know, people always tend to be a little anxious about taking more medication, particularly as we get older. What advice do you give them? Do you tell them if the medicine is there that they should take it and not be afraid of it?
No, I think each person has to you have to take a look at the individual profile for each patient. I'm assuming this patient's otherwise well with no other conditions. And honestly, osteoporosis treatment, when you're fighting diabetes and heart disease and multiple other medications, adding an osteoporosis medicine to that particular patient who's got life risk issues within the next 10-year period may not be the best thing for them. But for somebody who's going to expect to live a fairly long time, we don't want them breaking their hips just because we ignored 20 years ago or 15 years ago the fact that their bones were very brittle, and obviously probably a genetic trait. But some patients mean, it's an individual decision. Reclouse is not toxic, not side effect free. And some patients are going to have troubles with these kind of medicines. So I by no means put a blanket recommendation out to take it just because your bone density is low.
Okay, so people should take a look at what the side effects are and then weigh the risk and the benefits and make that decision with their doctor.
And discuss that with your doctor, and then they have some sense of the risk benefits of what they're using. It's likely they just want to have them take something to get it strengthened first, and then use some other maintenance plan to maintain that.
Okay. I have to ask Dr. Newman, as a follow-up to that, if there's food that this woman could be consuming that might help make her bones any stronger.
Well, we certainly know that foods such as sodas and like that phosphorus will rob the body of the bones. So you want to avoid any kind of garbage foods like that.
How about a big glass of milk every day? Could that help?
You know, I worry about that because it often can, your gastrointestinal tract can have a reaction to that. So I think the most important thing is lifestyle, the exercise. Get the stress on the bones, that increases the bone deposition.
Okay.
Magnesium, vitamin D, as the doctor said.
As she was doing. Okay, so we have another question for you. Should I take a multivitamin every day just to make sure that I'm getting all the vitamins and nutrients that I need? Is that just something that across the board all of us should be doing?
I don't think so. I don't think across the board. Essentially what we do in our offices is we test you. We see where your vitamin levels are. Multivitamins will always have some fat-soluble vitamins in them, vitamin A, D, E, and sometimes if you have too much of the vitamin A, it could be toxic to your liver, it could affect your eyes. So you really want to know your levels. So you really could ask your physician to get tested.
Okay, see, I thought it would be just the opposite to that answer, so I learned something new every time I do this show. I'm going to go back to Peter. Is it okay to take painkillers and blood thinners at the same time? This viewer writes, I have arthritis pain and I take Coumadin and heart medication daily, so I'm wondering if I'm doing something wrong by putting the two together.
Well, generally, the painkillers are short-term relief, and really the Coumadin interaction with painkillers is not extreme unless we're going to talk about the non-steroidal drugs. Now, that's a different story. Non-steroidals and Coumadin do interact, and there will be much higher bleeding rates and complications when patients mix non-steroidals like Motrin, ibuprofen, those sort of drugs, with Coumadin. So they should not do that unless they have specific permission from their doctor and they've discussed dosing also. So the Tylenol-based medications for pain will not have that effect on patients who are taking Coumadin.
Okay, thank you very much. And one final question from our viewers for Dr. Newman. What is your recommendation on how to treat IBS? Now, the viewer obviously is suffering from it, but not all our other viewers know what it is. So can you tell us quickly what it is?
IBS is irritable bowel syndrome.
Okay.
It's a whole myriad of symptoms, but typically it's gas, it's bloating, it's constipation, it's diarrhea. It's just tremendous gastric distress. So it could be what we discussed before, gluten sensitivity. It could be food allergies. It could be stress. The stress hormone can increase irritable bowel syndrome. It could be an overgrowth of the bacteria in the small intestine that you have to perhaps take the healthy probiotics that we often hear about.
We do hear about probiotics quite often. Is that something that also should be incorporated into our daily regimen?
I believe so. It's just so beneficial for your immunity. We have a symbiotic relationship. So many people go on various medications that will kill the healthy bacteria, and so we really want to replenish that.
So it can be treated. IBS can be treated and made people comfortable. Okay. Thank you so much. Dr. Hibbert, I want to thank you for being with us and for providing us so much information. We certainly look forward to talking with you again.
My pleasure.
And of course, Dr. Newman, thank you as well. I'll be picking your brain about what we can be eating, make ourselves as healthy as we possibly can be. More importantly, though, we'd like to thank you for spending this hour with us here on Meet the Doctors. We want to know what's important to you, so please send us your emails, tell us what you think, ask us your questions. Most importantly, though, stay healthy and happy. We'll see you the next time. I'm Lynn Doyle for Meet the Doctors.